Everybody's good? Okay. Hi, everyone who's checking in virtually. Just want to say hi to you. So today we're going to be presenting a talk on COVID. So it's called Understanding the Consequences of COVID-19 in a Cult Phenomenon, a Canadian Perspective. My name is Celeste Goguen. I'm a master's degree candidate at University of Moncton.
My name is Marie-Andrée Pelland. I'm a criminology professor at University of Moncton also.
So what's the plan going to be for the presentation? So the presentation is kind of going to be divided in 5 parts, essentially, based off our research question, which was, how did former members experience the last 3 years of COVID with periods of confinement and health risks? So we're going to be talking about the pandemic impacts on Canadians as a general idea, similarities between the cultic milieu and COVID dynamics, the methodology, the results, and what does this all mean? I put a little trigger warning possible just in case that if somebody feels uncomfortable by whatever topic we do discuss, there's no shame in leaving if you're uncomfortable. We totally understand.
So how Canadians experience the pandemic? Because if we want to know if the former experience was different, there were more crisis period, we wanted to know how Canadians in general experience the pandemic. So when the government first put together containment mitigation measure, they talk about all the time to flatten the curve. The government were talking each day on the news. There were health and uncertainties. There were stress associated with isolation. And there were pandemic fear in the population at large. That had consequences on the mental health of Canadians at large. Before the pandemic, 67% of Canadians said that they had a good mental health. During the pandemic, only 61%, so there were a decrease in mental health for Canadians at large. Also, women say that they had worst mental health during the pandemic, and also young people. So young adult, teenager had more episodic depression and suicidal ideation during the pandemic. But also another problem for the Canadian population at large, there was an impact on public safety. And social cohesion. So what does that mean? Crime increase in some area, such as IPV. So there were shelter were full, women were murdered at a higher number than before the pandemic. And also there were more time of unrest, manifestation, and hate crime in Canadians at large. So that created an atmosphere that could have impact on former members. So we before reading the result, we ask ourselves, how can former members see similarities between the COVID period and the theory on cultic dynamics? When we were thinking about it, some government talk on TV each day. For example, in Quebec, the government talked at 1 o'clock each afternoon. It was almost like going to church. A lot of people of the population were listening to that and thinking about it, and they were considering the government as gospel of truth, what they were saying. So for some of former members, we were thinking maybe they thought it was similar than when they were in a cult, because everybody was listening to the government and thinking that this is the truth that we have to follow. We were also thinking that maybe they were perceiving all the government rules as a system of control, and they could be an effect on their everyday life. And we also were thinking that they had some difficulty with all the rules, the scientific knowledge that was passed through the government, and it was perceived as a system of control. So we will see if former members perceive that in our research.
So to talk a little bit about it, how did we get there, essentially? So the research stems from a larger project, my thesis, which I'm working on currently, which has a qualitative approach to it. So a qualitative approach allows for longer periods of interviews and stuff like that. So we were looking at three major selection criteria. They're on there. I'm not going to list it. We were on a time crunch. But because of that kind of interview, we kind of had a narrative approach to the interviews. So because we had that approach, we really had varying degrees of interview times. So somewhere between 2 hours and 14 hours, really depending on how much the person wanted to talk. For the interviews, the average time was about 3 hours. And with all the people we managed to recruit, we had 20 people who were either on a phone or online, and one person was, well, in person. And with the analysis, the data analysis so far, we're really looking at two types of things, a situational analysis and a thematic analysis, which essentially allowed us to kind of create this PowerPoint, this research topic. Like I said earlier, how did former members experience the last 3 years of COVID-19 with periods of confinement and health risks?
When we look at what type of group that Celeste recruited, all of the group could be considered as a patriarchal institution. Even the group that they were led by a female, the decision-making process was made by men and powerful men in the group. Women were restricted to some kind of role in the community. So it's most of the group, all of the group that Celeste met were based on a culture of binary and gender hierarchy. So there were strict rules of what women can do and what men can do. Also, we have to consider that some roles were perceived as masculine or feminine. So men and women didn't have all the choice that they could have in the outside society. They have roles that they had to abide to. And also some men and all women had to work to the collective good.
So just to give an overview about what the participation looked like. So we managed to recruit 21 people overall. 13 of those were SGAs, or second generation, or born and raised, depending on what they identify more as. 8 people identified as joining as an adult, basically, and the average age was around 20 years old when they joined. In some cases, not everybody necessarily gave an explicit answer of the year they were born, so we kind of could no, not the year they were born, the year they joined. Sorry about that. But to give you a rough idea, we kind of did an approximation, and we managed to get cis men, cis women, and one person who identified as non-binary. But it's still important to note that we did not get any trans participants. So what are the results?
3 themes came through our analysis. So what is the reactions to the knowledge that were collected or perceived by them, the government knowledge, the cult knowledge, the question about confinement, how did they react to the confinement principle, and also how do they react to the social interaction and the support that was present or not in their everyday life. Celeste will, no, that's me again. Sorry. So when we think about the knowledge, what is the 2 themes that the sub-theme that emerge? First, the group that I was part of, does their knowledge was the best one to explain what we are experiencing right now? Or can I question the government knowledge that they pass on TV about the health crisis?
So when we talk about the group knowledge, a few participants talked really about how whether the pandemic was kind of proof for them. So in the case of Emil, he talks about how the pandemic really resembles essentially what Armageddon was for him, how it was described. So for him, he was kind of brought back to that, oh, well, okay, the pandemic's that's happening, it's Armageddon. Versus Raphael, who really started to question whether what she did, her choice of leaving, was wrong, because the pandemic was so similar to an apocalyptic situation for them, that they were really starting to question, well, okay, well, if I left and I was wrong, does that put everything into perspective? did I do the right decision? If they were all right, then why did I leave? Everything kind of gets a little jumbled for her. And then when we talk about government use of scientific knowledge, I know it's a lot. I'm not going to read all of that. It's a little heavy. But we really got two different ideas, kind of the other side of proof. For Raphael, she really thought about how usually, in cultic groups, whatever they say is what it is. And for her, it was really important to have the choice to research whatever her decision was going to be. To her, that was the side of proof that she needed. She understood she had to get vaccinated and things like that, but she wanted to choose. So for her, it was a side of research for that. Versus Brielle, Brielle really struggled with it because of the time she was in her group. So the group would always basically say, oh, the government's wrong, everything's wrong, whatever the government says is wrong. So for her, it's not that she was necessarily anti-COVID or anything like that, but she struggled with, I don't have enough information, I can't make this decision. What am I going to do with that? Because right now, all I do is I don't trust the government still.
The other thing that emerged was the confinement. So how did they react to the confinement? What it provoked in them? First, some reacted to the limited movement that they could do. For example, in Quebec, some city had to close down at 8 or at 10 at night. So that created a lot of stress for some of the participants. Some other had internal conflict. Because within the group, they were also confined, and they were also confined in the community, so it reminded them their experience within the cultic group. Some others say, no, the pandemics, the confinement is an opportunity that I must seize because it's for me a time of arrest to reflect on my reality. Some others, such as Canadian, experience mental health, PTSD, depression, and some others had suicidal ideation. And some other saw that time as a difficult time for social interaction because all of their interaction that they hoped to have when they were in the community were stopped with the pandemic. So Celeste will give us a lot of detail for each of these themes with the quotation of participants.
So when we talk about limited movement, for Florence, the issue wasn't necessarily the isolation. She enjoyed the isolation, like you can tell in the citation. But the issue was that she couldn't do anything after a while. She couldn't go to get groceries whenever she wanted to. She couldn't go for a walk. And that was really a trigger for her because it brought her back to the time in the group where she couldn't essentially leave. So for her, yes, isolation was good, but it was the rest, the limited movement in terms of anything like that, that was really the most difficult part for her. Versus Gabrielle, Gabrielle has a really interesting story because the group was saying one thing while her internalized feelings towards it was another thing, and the government had restrictions. So Gabrielle basically paints a picture that the group essentially was COVID's a scam. COVID doesn't exist. We should live our lives. And for her, as the citation kind of says, they were ready to move to the States. And at that time, flights were not happening and everything like that. And she also had a job outside of the group, which is rare on its own. So she was struggling because, yes, she understood she had to go because the cultic group wanted her to go, but she had a job which could danger others, and she didn't want that. And there was a lot of fear in terms of deciding what she wanted to do. So there was a lot of struggle for her, and that kind of led to her leaving, essentially was the beginning of the end for her. So another thing which is a little bit more common, like Marie-Andrée talked about in the beginning of the PowerPoint presentation, Canadians have gone through issues with mental health during COVID, and former members are no exception to that. Except some people did find it positive. A little bit, like Emil kind of points out, he didn't say he got COVID, but it was around that time, so he assumes. He ended up in the hospital. And for him, it gave him a chance to kind of disconnect from everything from his group. And it allowed him to research whatever he wanted to, if that's different ideations, different, I think he mentions Eckhart Tolle in the interview. He just wanted a chance to kind of branch himself out that way. But I mean, that's a little bit of the exception to the rest of how everybody else went. For a lot of people, mental health was a very big factor in in COVID times. For one person, PTSD became more of an issue, and in terms that it even scared them in terms of if it was going to affect their job. For others, again with Emile, he talks about having a depressive episode and a manic episode, which even brings to suicidal ideation. For some, well, Emile continues, he even mentions, he called the suicide hotline numerous amount of times. Leah essentially says, I tried to kill myself because she had lost faith because of COVID. And for Nikki, they really considered committing suicide because of the events of what they had done during their time in the group, and COVID had allowed them kind of to reflect on that a little bit more. And when we talk about the social interactions, so for some, before the pandemic, essentially, they were kind of thriving, and the pandemic stopped everything. So for Karina, that was a big issue for her because she was finally finding her stride, essentially, finding new people, meeting new people, and suddenly everything stopped. Her social life completely stopped, so she found it extremely intense. Emil, on the kind of the same idea, he kind of regressed in terms of his progress. He went from, oh, finding confidence, being able to look people in the eyes, he was alive, he was awake, and then COVID happened, and like he said, he didn't know how to meet new people anymore.
For our last team, two of our participants had very experience that we didn't see in other stories. One of the participants asked herself, did I make a mistake by leaving the group? Life would have been better if I will have stayed. Another former member said, no, pandemic was fantastic. I found a new community.
So it's a little interesting because they're both so completely different. So for Raphael, she was wondering if what she did was right and everything like that, but it was also that yearning for her to get back to that community that she had been in for so long, because she wanted that unconditional love. She wanted the idea of, if we're going to make decisions together, well, we're all together in this. And she was really, oftentimes, as the quotation kind of says, she reminisced on the people that she had made memories with, and she would love to still see them. And these interviews happened during the pandemic. And she says, I really would like to see them, but as a lot of former members know, oftentimes you can't see people or stay when you leave. Versus, for me, this one's kind of incredible, honestly. This person, Leia, essentially found a new group. When we interviewed, she never brought it up until she kind of stumbled onto it, essentially. And she essentially joined a conspiracist group. But for her, that's where she thrived. Because for her, in her time during her other group, she had a horrible time. And then, like the kind of quotation says, and I'm going to read it because it's really powerful, I found my people, over there. It really just spoke to me. The first 5 days, I just cried. Everyone was hugging us. We just made people cry. And it was unconditional love, then joy, then mutual aid. I've found my community. I found what I've been looking for all my life, Where else do you see this? It makes me a true member, absolutely. And I think it's powerful because we really see the difference between how one person yearns for what they had and one person creates something else, which might be a little extreme.
How can we reflect on all those data that we collected and we started to analyze? And it's the beginning. So some of the reaction were similar to other Canadians. So mental health decreased. They had difficulty with PTSD. But, former member had different reaction than the Canadian population. They had more complicated challenge to overcome. For example, some members had flashback. For some, it was like to be in a wormhole. even if after 10 years of being out of the group, they felt that they came back to the group with the confinement because there were so many triggers that they experienced in their cultic group. They were faced with the same reality, but in the community that they identify as more free than their cultic group. So that was really difficult. So and they ask themselves, does the society at large is a cult? Because the message that they received were so black and white, so they didn't know how to make sense of all those messages, and they were really conflicted with, I left a cult, and society is becoming a cult. What can I do? And it reflects a bit on your presentation yesterday. Also, they experience that time is a construct. Even if after 10 years I'm out, I still feel that I'm in my cult, alone at home. So that was really triggering. And what I also have to say is even if Celeste met first and second generation, in the consequences of the COVID, we didn't see differences between reaction for first and second generation. It's not the same with other team, but with the reaction to COVID, we didn't see differences between first and second generation. The other thing that they struggle about is that the regression that they experience in their idea, you know, they had made progress since they left the cult, but the pandemic stopped everything. They couldn't see their therapists, they couldn't talk to people, so they feel more isolated than when they were within the cultic group. So that was really difficult for our participants. We don't say that it's for each former member, but it was the case from the participant that Celeste met. So what did it say for me as InfoCult direct president? I reflect a lot about what can we do if we have other situation as the pandemic to help former members to strive also during that time. So what kind of crisis intervention can we put together to better help former members have a fantastic life even when the time is difficult, such as during the pandemic?